Okay, I think we are set. So yeah, off to you, Brian. I'll drop off as well. Thanks, guys.
Okay, just let me know how to
Thank
end
you.
it. Excellent. Well, all right, let's get rolling here. Welcome everybody, and this is our inaugural Meet the Scientists AMA here with Cerebrum DAO, and I'm really thrilled about this. We're planning on running these every month with all of our projects and even some of our pipeline and partners. We really want to elevate the science that we're funding and that we're seeing and that we're getting excited about, and make it available to the community to hear about it, hear about the exciting developments, to follow along in everything Cerebrum's investing in and developing, and also to meet the people behind it, what's motivating them, what gets them excited, learn something maybe personally as well, and just start geeking out about all the things that we're doing here around brain health and ending brain diseases with Cerebrum DAO. So this is exciting. Glad to get it kicked off. And the format, we're gonna have a panel discussion here with the scientists that are part of Project Transfidelity, that's recently funded by Cerebrum DAO in partnership with Molecule and Vita DAO. So it's a multi DeSci project here, which is also an exciting first, I believe. And we'll do a discussion for about 40 minutes or so, 35, 40 minutes, and we'll open it up to the floor for Q&A. So you get a chance to interact, and we'll answer what we can that's not proprietary for the research. So I just want to get it launched. My name is Brian Majerski. I'm with Cerebrum DAO. I'm the founder of it. Cerebrum's mission is to end brain disease. So we envision a world with only healthy brains. And we're going to be at it for as long as it takes to make that happen. We have a global community. We're a crowdfunded and governed organization. We funded several science projects so far. Transfidelity is one that we're featuring today in this inaugural event, and we'll be rolling out the rest of them in future shows. So I'm going to pass it to Ella first, to you, and introduce yourself, and then we'll meet our rockstar scientists.
Hi everyone, thanks Brian for having me. I'm very excited to be here today. I am Ella. My official job title is I'm Molecule Scientific Communications Lead. I have been with Molecule for about 2 years, and I have worked with Dimitri and Rashid when they were getting their project up on Molecule's IP protocol and getting it prepped for funding. So hi Dimitri and Rashid, it's lovely to see you guys again. Yeah, Molecule is basically the company that built the technological rails that enabled this sort of crowdfunding, crypto funding of Dimitri and Rashid's project. And so, yeah, it's really lovely to see the DeSci community bring a project to fruition. This project, I think, is close to a lot of people's hearts in that it deals with brain neurodegeneration, which I think is a topic that comes up a lot in the decentralized science space, with Cerebrum DAO, obviously, who is brains helping brains, and Vita DAO, which is looking at longevity, and I believe also Beaker DAO contributed to this project as well, who supports decentralized science projects. So yeah, that's me. That's how I fit in. Molecule is so excited and so happy to see this project up and running. And yeah, would love to hear from you guys, Dimitri and Rashid.
Awesome. Rashid, do you want to pick it up and do a brief introduction?
Yeah. Hello, everybody. I'm really happy. Finally, we reached this stage when we can start finally implement our ideas. And there was a great help from molecular side, especially from Ella. She really was guiding us through this process, and she made a lot of impact in this project to be implemented. My name is Rashid Akbergenov. I'm a researcher working in this molecular biology field for more than 25 years. And the main topic of mine is translation. And here we work in special aspect of this is fidelity of translation, which we now think, and more people agree with us, that this factor of as fidelity of translation becoming more and more important, and maybe will give us a key to solve a lot of problems, especially related to age-related, age-dependent diseases. Yeah.
Thanks, Rashid. Dmitry?
Hello, everybody. So my name is Dmitry Sharbakov, and now I am senior scientist at the University of Zurich. But soon I will move to Basel and completely focus on the project, which is now possible to complete and to go further with, thanks to molecule and the Cerebrum DAO. So we are really happy that now we are able to continue this project. And yeah, so I have more than 25 years of experience in scientific work. Most of my time was devoted to the study of translation, like with Rashid. I spent quite a lot of time developing small molecular drugs, antibiotics against bacterial diseases. And now we moved toward the aging and age-related diseases and what is the role of translation in this process. More precisely, it's fidelity of translation. And we think, thanks to the support of Molecule and Cerebrum DAO, we would be able to perform a breakthrough in this field. And yeah, so to go to the interesting and extremely useful outcome.
Amazing. So we are just so excited to have the caliber of talent and experience and brain power that you guys are bringing to the table, and the reputations of your respective institutions as well. I'll start out on a little bit of a light note, since this is kind of a DeSci party, as you're starting to hear from Molecule and Cerebrum and Vita DAO and Beaker DAO. You've got a lot of the pioneers in this space that all gravitated to you guys. So how has it felt to kind of be a pioneer for bringing science on the blockchain, and the experience of going through and seeing a community come together to fund your work?
So maybe I can comment on it, or let's say answer this question. So there are always pros and cons in every aspect. And in this specific case, we had also pros and cons. So we were probably first in the Switzerland, correct if I'm wrong, who actually received this kind of support. And as the pioneers, we had certain challenges during this process, namely that the universities here, which are major institutions where you can do research in the Switzerland, they are not very famous with this model. And it was really challenging to talk to them, to arrange everything, and to get a permit to do actually this kind of project. So because the universities here are more or less familiar with a system where you have, let's say, the normal investors, like VCs, for example, or something like that. And if you have a normal startup, let's say, official startup, you have official investors, the university knows their names and so on and so on. So it's okay. But this new kind of model was really something new for the universities, and it took us quite a lot of time, as you can realize. It's almost a year, maybe slightly less than a year, to be able to, let's say, to go through it and to get a permit from the administration to actually to continue our project and to do our project. Now, happily, we reached this stage, and we are really excited to be able to finally start the real research work and not all this administrative ping pong, let's say, and explanations and organizations and so on. So we are not high experts in this, and fortunately we get quite a lot of support from the molecular, from the cerebrum, and yeah, so some other institutions, and yeah, now we are there finally.
Okay, you mostly focused on contrast, right? I would like to say something pro, because there were a lot of good things during this process. Yeah, most of all, what I really liked that it was like mostly things built on trust and let's say simplicity, which I really liked when we just met first time molecular. It was like direct interaction without any kind of settings of criteria, whatever. People realized who we are and we realized what molecular is, and then in collaboration we built this project together. And then when we came to administrative things, of course they also supported us, especially Brian also helped a lot. There was also good support from Unitectra, which is responsible for IP from university side. So all together, finally we reached this stage. And what I like that there are many, when you go through other way, like normal way, when you raise money from special, let's say, dedicated for this organization, different from, let's say, crowdfunding, then you have to meet certain formal requirements, which sometimes really create obstacles. And in the case of what we have now, it's much easier and simpler and less formally. This is actually very much pro, which I would like to point out. So.
Well, yeah, we really appreciate you joining us on the frontier. I spent a lot of my life in the United States Southwest, and the frontier is it can be a little rough sometimes. That's why pioneering is difficult. So there's always pros and cons, but you're there. And one of the things, like, I'll put Boost VC in the spotlight. So they're a backer of Cerebrum DAO, and they've got a motto that says "Be the cockroach." So I really like this because I'm a long-time entrepreneur, and like, you just persist and you never die, no matter what the circumstances are, and you get to your finish line. So they're a big supporter of DeSci, and it's great that they appreciate Frontiers people too, because their funding of us enables us to support amazing projects like you. So let's get into it. I think everybody's dying to hear what we actually funded and why so many of these DeSci pioneers funded your project. Would you like to describe to the audience what exactly is translational fidelity? What are some of the mechanisms it addresses? How does it play in aging? What type of diseases do you think it's relevant to? And what exactly is a translational error? If any of those questions make sense to you, that would be awesome to hear from you, and our audience can understand what we're developing here.
Good. Okay, maybe again I will start, and maybe Rashid then support me and yeah, so extend what I'm going to say. So translation actually is a major process in the cell. It's producing of new proteins. So everything what happens in your cell happens thanks to the proteins. So DNA stores the information, but how is information is realized? It's a question to the proteins. So they do everything. And the proteins, it's like small molecular machines, and they are continuously produced and discarded. So like everything, they are produced, they do their job, and then they will be discarded. And the major player here is so-named ribosome. This is a huge machine which produces new proteins. So actually, ribosome takes the information which is in DNA. So it is translated to the ribosome with the help of RNA, special RNA molecule, and then ribosome produces the new proteins. As soon as those proteins are not necessary anymore, they are discarded with a specific systems, like so just let's say protein trash system. Let's call it this way. And like every process, this process is error. It's not error prone, but errors are always happens during this synthesis on new proteins. So the ribosomes do mistakes, and those mistakes leads to the non-completely functional or completely non-functional proteins, which should be then utilized. The problem is that first, the ribosome itself consists of the proteins. So the more mistakes it did, the less precise and less functioning ribosome itself is going. And this process starts actually from your birth, let's say, or even earlier. And you have always accumulation of this non-completely functional, misfunctional proteins. When you are still young, this system is still able to continue to work and still remain in equilibrium. But when you're getting older, those mistakes are just accumulated, and it leads ultimately to the misfunction of more and more cellular systems. And ultimately, you have either disease or aging or both. This theory was first formulated in 1960 by the British biochemic Orgel, and it's so named error catastrophe hypothesis. It's interesting. It's actually easy and clear to grab, and there were a lot of experiments done to prove that this really happens like that. And that's actually what is our very last paper about. That's the paper which we actually presented in preparation to this talk. In this paper, we were able to demonstrate on living mice that really during aging, the fidelity of ribosomes in your body, or in this case, it's a body of the mice, of the animal model, getting down. So you have less and less and less precise translation. Ultimately, what happens, the proteins which are not quite well or just with errors translated, they are extremely tend to aggregate and to produce a cellular garbage. And if there is a decline in your cellular clearing mechanisms, like proteasome or lysosome autophagosome system, then you have a problems. The aggregates accumulated, and that's more or less what you have in your Alzheimer's disease when you have accumulation of plaque or tau tangles, so named, or in Parkinson's disease when you have accumulation of alpha-synuclein aggregates. So that's in brief our hypothesis. And our aim is actually to try to improve fidelity of the ribosomes. Obviously, it is possible. It is possible with usage of mutations. So it's possible with genetic manipulations. And we are sure that it is also possible to do using the small molecular drugs. That's what is actually our project about. So searching for the small molecular drugs which are able to bind to the ribosome or to affect the cellular processes in such a way that we increase fidelity of translation. And therefore, we decrease the amount of aggregated, misfunctional, and harmful proteins in the cell.
Maybe I add a little bit. So, as Dmitry already mentioned, majority of these age-related diseases are associated with accumulation inside cell of aggregated proteins. What is aggregated proteins? These are proteins which are not anymore functional. They form like some kind of cellular garbage. And because of presence of this garbage, a lot of mechanisms are activated in cell. First of all, mechanism which clearance mechanism which should theoretically remove this garbage, and then cell is healthy again. But with, as Dmitry mentioned, with aging, like efficiency of this clearing machine decreases, deteriorates, and finally cell accumulates so much garbage that it finally dies. Yeah, this is, and because of this, in case of, for example, Parkinson or especially Alzheimer's disease, specific cells in brain start to die, and then people lose these neurons in the brain, and of course, then finally they it ends up with the death. Actually, not only brain but human in itself, in himself. And what I also wanted to point out, so not every cell in human organism accumulates this inability or higher infidelity of translation, because each cell in our organism has a certain lifespan. For example, our blood cells or our liver cells, they live very short life, and they also all the time divide, so they multiply. And that's why there is always renovation happening in these organs, like in liver, in blood. So that's why many of these blood cells, they don't suffer from this problem. But our other cells, like muscle cells, which can last in our organisms for tens of years, or specific cells in blood cells, also like lymphocytes, or in other cells, and especially our brain, these cells are living for practically, especially brain cells, they live during all our lifetime. So, and during this long time, cell does not divide anymore, and whatever is accumulated there should be cleaned. Whatever garbage is there should be removed. And with aging, as Dmitry mentioned, the efficiency and fidelity of ribosome producing protein decreases, and more protein become misfolded because of wrong build, wrong composition, and then misfolded and then become aggregated. And problem is more like when a cell needs to remove this aggregate, there are special cells which try to fold it properly, so-called chaperones. And these chaperones start to interact with misfolded proteins, try to unfold it, fold it again, and it's like all the time the struggle going on. But if you have misreading, some proteins cannot be folded at all because they already have wrong composition, and these chaperones become bound to these impossible to fold proteins, such that they aggregate, and this helper, which should solve the problem, becomes part of the problem. So accumulation of garbage increases with higher infidelity. You can imagine this is self-fueling process, and this is especially important in brain. That's why we think that our approach, when we try to improve fidelity, increase fidelity in cell, in living cell, by whatever means is, it could be like genetic modification, but I think more realistically, now it's probably drug would be good thing to think about. So then it's really should help to neurons. That's what I wanted to add.
Brian, if you don't mind, I also wanted to jump in and ask a question here. So kind of, I think from what I understand what you're saying, and I've seen this project before, so I do have a bit of background knowledge to those listening. But from what I understand, there's these two sort of critical breakdown points when it comes to protein accumulation in cells, which is A, proteins can start to be built in correctly, which makes them kind of sticky and aggregate. And then there's B, it's also, okay, now there's also a breakdown of these systems that would clear out these broken proteins. And as far as I know, as we age, both of those systems start to have issues and start to sort of slow down and get impaired. If you guys are targeting the sort of incorrect protein folding, so like this A process in the beginning, would this treatment ideally be a preventative treatment that one would sort of take as they start to get an onset of symptoms? And have you sort of started to think around when and how and who would be taking this desired medication?
Okay, so I think that it could be preventive depending on stage when it's applied. So if it's the process is not gone so far too much, so you cannot revive that cell. So if human already brain is like damaged and partially lost cells, of course you cannot restore it back. Yeah, but at least you can stop the process at that point. But then this is maximum what you can achieve. But if you apply this drug before cell is dead, there is good hope, good probability that this cell will not anymore progress to the disease and maybe even recover completely, because you like prevent formation of new aggregates by reducing the number of mistakes made by ribosome. And then the clearance machine, which is always there in brain, it's very efficient in cell. It can do the job and really like, because so-called there is a term so-called proteostasis. Proteostasis is the balance of the protein inside cell, and every cell should contain certain amount of certain protein in certain location. So misreading makes it like, first of all, wrongly produced, wrongly placed, and wrongly folded. This all three, and if you exclude all these three, yeah, then the proteins which are responsible for clearance will manage and do this job much better, and then maybe cell neuron can recover after higher fidelity.
Yeah, so this is one of the reasons why we're so excited about this opportunity. Cerebrum's mission has been to, really have a unique approach to the space so we can really accelerate solutions, and potential cures to things like Alzheimer's disease, Parkinson's, and all these that are just lacking from effective therapeutics right now. And so the way we're going after that is really treating the brain as a function of aging. And so, brain disease is a function of aging, and looking at the upstream mechanisms and interventions that we can have. And that's why, I think we came together with this partnership with Molecule and VitaDAO, around longevity and aging and brain health. The question to you guys is, do you see I can envision a very bright future for this, because we have blood-based biomarkers coming on the market now that are able to detect things like amyloid and tau buildup before symptoms come. And to your point, the thing that's very clear here is what I found is reversing symptomatic Alzheimer's is an immense challenge, if it's even feasible. But getting upstream of it when it's pre-symptomatic for decades, and just some of what you guys have described on the cellular mechanism level and the translation level, of protein aggregations happening and the garbage is building up, but it's not too late to slow it down or stop it. And then so one question is, do you share that optimism, something like what you're developing here and what we could translate into a small molecule could be leveraged with these early indicators of diseases like Alzheimer's and plaque and tau tangle buildup decades early, and that's how we have the intervention with what we're developing here. And then the other question is, could this be a prophylactic as well for something that we know, which is a genetic mutation like a single copy or a homozygous copy of APOE4 for Alzheimer's? And then you would say, well, just because somebody's got this genetic situation, they should be taking something like we're developing here to support them throughout their lifespan.
Answer is yes, actually, for both of your questions. So, of course, the earlier we start treatment, the better. It's obvious, it's true for every disease, probably every conditions, and here it is especially true because the earlier we start intervention, the more neuronal cells we can save. It's clear. So if we would be lucky enough to have very good biomarkers, so being realistic, we can assume that in the best conditions, the possible drug will come to the market in 8 to 10 years. So definitely not earlier than in 5 years. So just no question. And if at this point we will have a good biomarkers for the pre-symptomatic Alzheimer or Parkinson, then we can start treatment immediately, and we have a very good chances to slow down, to stop, to prevent the development of all those diseases. Parkinson's or Alzheimer, frontotemporal dementia, actually everything which has something to do with protein aggregation. Because vast majority of those neuronal age-related diseases are so-named proteinopathies. So they have a specific protein, which, as Rashid mentioned, is not in the proper place, not in the proper condition. They tend to aggregate and accumulate the aggregates and so on and so on. And we hope that we would be that it would be possible to stop this process and even to invert it, let's say, to resolve the already pre-aggregated proteins if we make the cellular clearing mechanisms just so free to do their job. What is also could be interesting and important, that actually nowadays there are some drugs under development which are actually targeting the protein existing aggregates, like different disaggregases and so on and so on. And the advantage of our therapy is that it's perfectly compatible with these development drugs. So we are focused on preventing of aggregation of the new misfolded and aggregated proteins. And this therapeutic approach is perfectly compatible with any therapeutic approach which is focused on disrupting of the existing aggregates. So in this respect, there is no clear competition between us and other developers, but it's additive, synergistic approach.
Fantastic. Maybe you can walk us through the roadmap ahead. Like how do you envision translating from where we are toward that potential small molecule therapeutic, and what are some of the early next steps that the research funding that you've just secured through this mechanism is going to enable, and some of the things you're looking to prove?
Okay, maybe I start and Dmitry probably follows, because project is so we started working on it around already 2 years ago, right, Dmitry?
Something like that, yeah.
Yeah, something like that. So our idea was just to check whether it's really possible to increase fidelity of working ribosome. So for this, you can do and employ different systems. Like we use 2 systems mainly. It's a cell culture system where we can produce protein of so-called reporter protein, which we can afterwards analyze and see whether it's properly synthesized and measure fidelity in these cells, right? And another system is so-called in vitro system, where we just have ribosome doing the job inside the tube without cell. Right? So all components of translational machinery is in tube, We just provide again mRNA, which is like necessary information for protein synthesis, and finally we analyze protein which is produced in this tube for fidelity of our ribosome. So these two approaches. Using these two systems, we first did screening of library of several thousand of compounds and checked whether any of these compounds will be able to increase fidelity of translation. And by this means, we managed to identify several compounds which could increase fidelity of ribosome in vitro system, and in other set of compounds which could increase fidelity in cell culture. And they were different. They were not same. So those which could increase fidelity in vitro, we named them direct compounds. It means they directly interact with ribosome or with process of translation such that fidelity increased. So we have higher, let's say, quality of production. So that's it. And those compounds which were identified in cell culture system, they cannot do the same job because we call them indirect compounds. They should modify some of the compound inside cell such that fidelity of translation increases. So they don't interact directly with the ribosome, which is doing the job, but they do something, some modification on any compound. There are around 1,000 actually pieces, parts of translational machinery which participates in protein production inside cell. So and these compounds, which are indirect, are especially interesting because then we can using these compounds identify the pathways inside cell regulating fidelity. Yeah, and then when you know these pathways, you know what proteins and enzymes are regulating the fidelity. You can afterwards manipulate and find proper chemical which can interact with these parts of the pathway and manipulate translation fidelity. That's our goal. So, and first part of our, let's say, was to identify compounds, which we did, we succeeded. Now, next step will be to find out exactly, identify the members of this chain which regulates fidelity on ribosome. This would be. And then we, of course, have these drugs and we can go in the way like optimizing it, making it more efficient. And so this will be also part of our project. But another very important part of our project will be identification of the target of our drugs. So, and then Dmitry may explain more. We will use this drug in different cell cultures. Maybe you continue, Dmitry.
Yeah. So as Rashid already mentioned, I just summarize a little bit. So there are two major ways of our further work. Namely, first, it's improvement and modification of the compounds we already have. They are efficient, but we are sure that we can increase their efficiency because we just found them as, let's say, raw molecules. They are with confirmed biological activity, but our goal now is to try to modify them in such a way that the fidelity modulating activity is increased. That's from one side. From another side, as Rashid also pointed out, we do not know exactly the mechanism, how they do. We have some hypotheses how in principle it is possible to work there, but we do not know exact chain and exact members of this chain. If we would be able to identify this chain and identify the individual members of this chain, then we can do a so-named drug design. So in such a way that we would be able to affect the members of the chain more specifically. And then it would be possible to improve fidelity even more. Maybe we can affect several members of the single chain or model a drug which is highly efficient in this respect. So that's our second, let's say, target. And of course, it is included in the project as a not primary, but secondary goal. We probably will screen another libraries in order to find more promising candidates, which we can also test, improve, and go further with that.
Very exciting. So, and I know we're planning to kick this project off 1st of May. And so we're very close to getting rolling on this. Elle, I wanted to kind of turn the floor over to you, and before opening it up to our community for questions. I know you were integral with Molecule on sourcing this amazing project and these wonderful scientists. I'm sure you have a lot of hope for this project and excitement about some of the next steps. What has you excited about the next steps and the potential personally and from Molecule's perspective?
100%. Well, I mean, first and foremost, my ultimate hope for this project is that it's, deeply successful and the science works out and we get this wonderful medication out of it. That being said, I think from this DSI point of view, and from the Molecule point of view, is that I think Dimitri at the very beginning mentioned, the collaborative aspect of this project. We've had, obviously the 3 DAOs that have contributed to this project, Molecule's been involved, obviously Dimitri and Rashid, and not to mention, all of the individual project contributors that all sort of, contributed to this project to get it off the ground. I'm really excited for that to continue. And for that, this use case of decentralized science to really grow bigger and leave ripples. I think it is a wonderful proof point to really see that, money raised through the DeSci ecosystem is, directly going to researchers, helping research get done. I think it's a wonderful proof point. I'm excited to be involved in it. And actually, it does make me think of a story a while back. I was actually, before this call, I was going through some of our previous materials that we worked on with Dimitri and Rashid last year. And there was a call where I think Dimitri, they were pitching to Cerebrum, not Cerebrum DAO, Beaker DAO. And one of the members in the call, I believe it was James Brody, made a suggestion for the project. And Dimitri and Rashid were like, that's a great suggestion. And they have since implemented that in their project plan. And I think really that is the testament of decentralized science, where it's not just, some grant body that just declines your application for funding and doesn't ever follow up with you. It really is this team bonding and team building together. And I'm really excited for all the things that come from it.
Yes, I remember. I remember this, yeah.
Well, it was great that you led with that collaboration, and you also used the word trust in the process. I think both of you did, and obviously just the credibility and the potential impact that this work can have. So a lot of times when you look at a blockchain-based or crypto-based project, those terms are all absent. Collaboration, trust, and even impact sometimes, fair amount of time. So it's great to get the word out about this, so people can see what we can actually do by coordinating such great talent and money and ideas through this token mechanism and these organizations. So it's all in the community, and with that, I'm hopeful. We have some questions out in the community, and hope our group isn't bashful or afraid to ask science questions. This can be a lay audience, and you can ask a lay question. We all have an impact on our brain health. So we have our first one. So I'll go ahead and ask it. Okay, so I wonder, since the cells have different lifespan, would you expect differential depending on the tissue? Differential outcomes depending on the tissue?
Yeah, that's actually, I can answer easily, because this what our latest paper about is. So we with our later work, which was published just in February, studied whether translation fidelity changes during lifespan of mammalian in mice. What we took as a model organism was mice, and we created special transgenic mice where we could in vivo, like during in living mice, measure fidelity of translation. We didn't kill mice, we just could take a pictures from time to time, let's say every month, and see the production of the protein, which should not be normally produced, but is produced only in case when ribosome makes a mistake. This was a system which we employed. We designed it ourselves. We created these mice and then just followed took the pictures, and we saw that in retina, which we could see like without intervention, whatever, and in liver, which we could also take a picture of, and also in muscles, we observed different effects. So, as I said, liver cells, they exactly to answer this question, which was asked, in liver, we didn't notice any difference. So there was no accumulation of misreading with aging, because liver cells live very short time, so they always proliferate.
Renovate.
So they proliferate. They belongs to the class of so-called pre-mitotic tissue. This is a tissue which still can proliferate and divide. While brain and the retina is a part of the brain, and muscle, which are also post-mitotic tissues. It divides once and then doesn't proliferate. It just grows in size. Same with neurons. They get born and then they stay with us without the further division. So, and in these tissues, we could observe accumulation of misreading with aging. And this was also finally confirmed with the different approaches. Yes, it's true. It's tissue specific.
Okay, we have another one. Is it possible to monitor translational fidelity and related biomarkers in clinical settings to assess drug activity and safety?
I think it would be possible, but only in certain, let's say, blood cells. If you from time to time take blood, and this we have to, there are some certain class of cells in blood which also live quite long. So, and T lymphocytes, for example, they can live for tens of years. And if we manage to measure the fidelity in the individual cells, this could be possible. But we should first establish it. And currently in human being, I don't think there is a way to monitor translation fidelity.
Especially in neurons or in muscle cells. It's still invasive. So we do not have transgenic humans which we able to monitor like we did with mice. Therefore, so we can think about it, but for the moment, it's not possible.
Got it. Perhaps a more general question on scientific projects. So, like with Cerebrum, again, one of our hypotheses is we're not taking enough shots on goal to go after a lot of these brain diseases. And we don't have a broad enough diversity of hypotheses. Do you think that there are a lot of unfunded opportunities, scientific projects with researchers like yourself that just are not attracting the funding that they deserve, but to have promise, like this project, to actually translate into impact outcomes? And in your experience?
It's a little bit related. So this question, you mean?
Yeah.
And, the answer, it's a little bit related of the mindset of many researchers. because many basic researchers, and we were actually more or less at the same mindset, they are focused mostly on producing the scientific results, and they are thinking about the possible application of those results. But somewhere in the future, somewhere, blah, 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 maybe in 10 years, maybe in 20 years, maybe never, because, so it's a different mindset. So they're interested in the results, how does it work, and whether it is possible to change or not. But a lot of times they are not very much focused on how to use it right now. And we were lucky enough because our mindset, actually, since we were involved in the development of the antibiotics, so our mindset was also somehow set on the outcome. And when we had a good idea, actually, that probably we can affect the ribosomal fidelity, and this will probably outcome the possible therapy against protein aggregation-related diseases, we will immediately think about, well, whether it is possible to do it. We know that it's possible to do it with genetic manipulations, but is it possible to do it with the small molecules? Are those molecules would be a potential drug? And I even remember when I had this idea, it was in 2022 on the conference, it's so named Aging Research and Drug Development. It's a very famous conference concerning aging. And when I had this idea, I immediately discussed it with Rashid, and we said together, yes, it's very interesting and potentially a very promising approach. We should definitely try it. And what is also important, last but not least, we are not young, boss. And we have also personal interest in the development of this kind of therapy.
Absolutely. Yes, absolutely. Well, good. I hope with more and more science getting funded earlier and being exposed through formats like this, that it may inspire more of those scientists to think about what might be outcome-driven opportunities versus just publishing. Not to diminish publishing; it's very important. But we do want to see these things actually get to humans and help us and have impact. I have another question. We may have time for one more if somebody wants to pop it in, but I'll ask this one and we'll see where we are on the clock. We've got about 8 minutes left. So the question is, I was wondering, given the dynamic nature of intrinsically disordered proteins like tau, which are central to several neurodegenerative diseases, how is fidelity understood or regulated in this context?
I can try to start the answer, maybe Rashid then extend it. So the question with fidelity is always a kind of trade-off in the ribosome between fidelity and speed of translation. If you need to produce more proteins, then obviously you will be less precise. If you need less proteins, then you can allow yourself to be more precise and more careful. And that's what happens actually in the ribosome. So, and when the ribosome tries to fulfill the requirement of the cell, so the already aged, not so quite effective ribosome, and it tries to fulfill the requirements which so essential for the cell, then the ribosome starts to be less precise, and it produces more and more erroneous proteins. So, and the problem is that in this way, ribosome also disrupts itself, because ribosome consists of the proteins. So if ribosome starts to produce proteins with mistakes, then the ribosome itself getting less and less effective and made further more and more mistakes, and this is autocatalytic process. So what we actually want to do, we can, so we want to force the ribosome to be more precise, to produce less proteins, but with a higher level of so fidelity. And in this way, we hope we will be able to decrease the amount of cellular garbage. And it includes also tau protein, so tau tangles, and actually all cellular proteins.
I can add a little bit. So you know about this core, let's say, problematic proteins for each diseases, like tau protein for Alzheimer, maybe Parkinson partially, or alpha-synuclein for Parkinson, and beta amyloid for Alzheimer, and so on. And I think they like serve as of center of crystallization, like formation, beginning of formation of aggregates. So if you have this, it will always come, because these are aggregation prone proteins. They even properly synthesized will be like prone to aggregate. They will form aggregates anyway. But the question is whether other protein will finally co-aggregate with it. So whether the environment is supportive for formation of aggregate or not. And it will depend on even you fidelity is good for, and you don't, I don't know, did anybody analyze these tangles in terms of preciseness of production? You know, whether the people, maybe it's possible to do with mass spec and so on to find, to detect some like pieces of this protein which are misproduced, like produced with mistakes. But when you have general misreading, let's say production high in the environment, then other proteins will be more prone to co-aggregate with this core, let's say, crystallizing proteins. You know, did you understand what I mean? Or maybe it's not clear. So fidelity is not necessarily will touch and produce better these specific proteins, alpha-synuclein, tau, beta amyloid. But if environment of other proteins, so other proteins are not aggregation prone, they will not co-aggregate and then co-precipitate. No, and then the machine which is responsible for removal of these naturally aggregation prone proteins will be able to do the job and clean it, because there is no more additional burden on them to clean the rest, and then less probability of formation of these aggregates, because the environment is not supportive for formation of aggregates. This is another like indirect factor, which is really, I think, one of the important points in this.
Yeah, I think from what you're saying, this really drives home the point of targeting like the root cause and the origin of where things go wrong, instead of sort of retrospectively trying to combat these protein aggregations once they're formed.
100%. Root cause is what we're about. Yes, I think that that's a great way to summarize it. We have 2 minutes left. I'll only need 20 seconds to close. Anything else you'd like to share in a minute and a half that we haven't asked or you haven't shared yet?
So just to summarize, thank you, Molecule, thank you, Cerebrum DAO, thank you, Beaker, to allow us to proceed with this exciting, really exciting project. And we are happy to proceed. We are, as I mentioned briefly, so we have also personal interest in that, and we will invest all our time and efforts to bring this project to the successful end.
Yeah, absolutely. I completely agree. And again, thanks. Hopefully, yeah, we will do whatever it depends on us. So we will apply all our expertise to this project.
Well, we're proud and excited to be working with you, and thank you for the trust and persistence and collaboration. It's been a wonderful effort, and we're just getting started. So really looking to get it kicked off, and we're going to have these Meet the Scientists on a monthly basis. So I know you guys are going to be back with some great news on the progress in the not too distant future, and we're looking forward to that too. And thanks everybody for listening in. And whether it's live or on the future recording, we're happy you're here.
Thank you. So
Thank
we
you
are
very
happy
much.
to participate.
Thank you so much, guys.
you.
Thank you.
Yes.
Thank you.
Bye-bye.
And thank you, Brian. Bye.
Bye-bye.
Thanks.
Bye.
Thanks,
Bye.
everybody.
Thank you.